Stop for a moment. Think about the last time you sat down in the bathroom and nothing happened. You pushed, you waited, you pushed again, and the harder you tried, the worse it felt, like your body was working against you instead of with you. If that sounds familiar, you're not alone. And more importantly, you're not imagining it. Here's something most people never hear. Straining harder is not the solution. In fact, for many adults over 60, straining may actually be making the problem significantly worse. And in some cases, it may even be damaging the very muscles responsible for solving it. Because stool stuck in the rectum isn't simply a plumbing problem. In many cases, it's a signal that something has changed inside the body, in the muscles, the nerves, or the systems that coordinate one of the most natural functions your body performs. And once you understand what's actually happening, you may never approach this problem the same way again. Today, I'm going to walk you through what causes stool to become stuck, why straining so often backfires, and what you can actually do, starting today, to help your body work the way it was designed to. Because the solution may be simpler than you think. But first, you need to understand what's really happening. So what's actually happening when stool becomes stuck? Most people assume it's simply a lack of fiber, or not enough water, or just getting older. But here's what most people never realize. Your body isn't trying to cause constipation. It's simply doing the job it was designed to do. Your large intestine has one main responsibility: to remove water from whatever passes through it. And it does that incredibly well. The problem is, your colon has no way of knowing that the stool has stopped moving. So it keeps doing its job. Hour after hour, day after day, it keeps removing water, little by little. What was once soft and easy to pass gradually becomes drier, firmer, and much more difficult to move. Not because anything new was added, but because more and more water was taken away. And here's where the problem quietly gets worse. This rarely happens overnight. It usually builds over several days. You may still be having bowel movements. You may even think everything is working normally, but each time, only part of the stool is actually leaving your body. Some remains behind. It becomes a little drier, a little harder. And the next day, the same process happens again. Now add one more layer. After 60, the muscles that move stool through the colon often become less efficient. The nerve signals that trigger a bowel movement may become less reliable. And many common medications, especially those used for blood pressure, pain, or sleep, can slow the digestive system even further. None of this means your body is failing. It means several small changes are working together, creating a problem that most people were never taught to understand. And once you understand what's really happening, the solution starts to make much more sense. So why does straining make things worse? Most people assume that if something feels stuck, pushing harder is the obvious solution. But inside your body, the opposite is often true. Here's why. Deep inside your pelvis is a small muscle called the puborectalis. Most people have never heard its name, yet every bowel movement depends on it. Think of it as a sling, a muscular loop that wraps around the lower rectum and helps keep stool in place until your body is ready. Now here's the part that surprises most people. For a bowel movement to happen, that muscle has to relax completely at exactly the right moment. When it does, the angle of the rectum straightens, the passage opens, and stool can move through with surprisingly little effort. But when you strain, your body may respond in exactly the opposite way. Instead of relaxing, the puborectalis muscle can tighten. You're pushing harder, while the exit is becoming narrower. The harder you push, the harder your body may resist. This problem is known as dyssynergia, and it becomes much more common as we get older. The nerve signals responsible for coordinating these muscles can gradually become less precise, which means the muscles don't always work together the way they once did. That's why so many people spend years straining on the toilet without understanding why nothing seems to change. It was never simply a problem of strength. It was a problem of timing and coordination. And once you understand that, the solution starts to look completely different. Now, here's something that surprises almost everyone. And if you misunderstand it, you could make the problem much worse. Believe it or not, some people with stool stuck in the rectum don't become more constipated. They develop what looks exactly like diarrhea, watery, unexpected, and often completely confusing. So, naturally, many people reach for an anti-diarrheal medication. That may be one of the worst things you can do. Here's what's really happening. A hardened mass of stool is blocking the lower rectum, but softer stool arriving from higher up in the colon still has to go somewhere. Since it can't move through the blockage, it slowly leaks around the edges. What comes out looks like diarrhea. But it isn't. This is called overflow diarrhea, and it's one of the most commonly misunderstood symptoms of severe constipation. Because it looks like diarrhea, it feels like diarrhea. But the real problem is a blockage. Now imagine taking medication designed to slow your bowels even further. Instead of helping, it allows the stool to become even drier, even harder, and even more difficult to pass. If you ever notice watery leakage, together with a feeling of pressure, fullness, or the sensation that stool is still stuck, don't assume it's ordinary diarrhea. That combination deserves medical attention, not suppression, because your body isn't malfunctioning. It's trying to tell you that something is blocking the normal pathway. And recognizing that message could prevent the problem from becoming much more serious. Now let's talk about something that many people wait far too long to address, because stool stuck in the rectum doesn't always remain a manageable problem. For many people, it does. They recognize what's happening, they make the right changes, and things improve without further treatment. But sometimes, the blockage continues to build, quietly, day after day, and that's when the risks begin to change. Here's why. The wall of your rectum is living tissue. It depends on a healthy blood supply to stay strong, as pressure from a blockage continues to increase. That blood supply can gradually become reduced. The tissue becomes weaker. The muscles become less effective. And moving the stool becomes even more difficult. In rare but serious cases, if the pressure becomes severe enough, the wall of the bowel can tear. That allows bacteria from inside the bowel to enter the abdominal cavity, causing a life-threatening infection that requires emergency medical treatment. I'm not telling you this to frighten you. I'm telling you because recognizing the warning signs early can make all the difference. So, how do you know? When it's time to stop trying home remedies, there are 5 signs you should never ignore. A hard, rigid abdomen. That's painful to touch. A fever above 101 degrees Fahrenheit. Severe abdominal pain that continues to get worse. Complete inability to pass gas, or persistent vomiting. If any of these happen, don't wait until tomorrow. Don't try one more laxative. Don't hope it will simply pass. Seek urgent medical care immediately. These aren't signs to keep watching. They're signs to act. Because when it comes to a serious bowel blockage, acting early can make a critical difference. So, what should you actually do if stool feels stuck? Let's go through this step by step, because if you're dealing with this right now, you need clear, practical guidance, not guesswork. The very first step is simple. Stop straining completely. Every time you push as hard as you can, you increase pressure on tissue that's already under stress. You also make it more difficult for the muscles around the rectum to relax the way they're supposed to. So before you do anything else, stop forcing it. Step 1. Soften the blockage. One of the most commonly recommended over-the-counter options for stool that's already in the rectum is a glycerin suppository. Unlike laxatives that work higher up in the digestive tract, a glycerin suppository works directly where the blockage is located. Follow the directions on the product label carefully. Before inserting it, applying a water-based lubricant can make the process more comfortable, especially if the tissue is already irritated. After insertion, give it time to work. Don't rush to the bathroom after just a few minutes. The suppository needs time to dissolve and begin softening the outer layer of the stool. Step 2. Give your body a chance to respond. Once enough time has passed, stand up slowly. Walk around your home for a few minutes. Drink a glass of warm water. Then return to the bathroom without straining. Sometimes, the first attempt softens only the outer layer. A little more time allows your body to finish what it has already started. Step 3. Know when it's time to seek medical care. If you've tried appropriate home measures, allowed enough time, and the stool still won't pass, don't keep repeating the same approach over and over. This isn't a failure. It's simply the point where you need additional help. Medical professionals have treatments available that simply aren't possible at home. And in many cases, relief comes much faster than people expect. The most important thing is this: don't let embarrassment keep you from getting the care you need. A problem that's treated early is almost always easier to manage than one that's ignored for days. Clearing a blockage is important, but preventing the next one is even more important. Because once this has happened once, it's much more likely to happen again if nothing changes. The good news? Many of the most effective preventive habits are surprisingly simple. First, stay ahead of dehydration. Don't wait until you feel thirsty. After 60, your thirst signal naturally becomes less reliable. Try drinking water consistently throughout the day, and whenever possible, start your morning with a full glass of water. For many people, that simple habit helps stimulate the natural movement of the intestines. Second, keep your body moving. Your intestines are made of muscle, and muscles work better when you move. Even a gentle 20 to 30-minute walk, or simple chair exercises if walking is difficult, can help keep your digestive system active. Third, review your medications. Many commonly prescribed medications, including certain pain relievers, iron supplements, antidepressants, and some blood pressure medications, can slow the movement of the bowel. Don't stop taking them on your own, but do ask your doctor or pharmacist whether any of them could be contributing to the problem. Sometimes, a simple adjustment is all that's needed. And finally, pay attention to your posture. Most modern toilets place the body in a position that isn't ideal for emptying the bowels. Raising your feet on a small footstool so your knees sit slightly higher than your hips can help straighten the angle of the rectum. For many people, that small change makes bowel movements easier, with far less straining. None of these habits is a guarantee, but together, they give your body the best chance to do what it was designed to do, naturally and comfortably. If there's one thing I want you to take away from today's video, it's this: stool that becomes stuck in the rectum is not simply a part of getting older. It's not something you have to accept, and it's not something you should ever feel embarrassed about. It's a signal that your body needs attention, and the sooner you recognize that signal, the sooner you can do something about it. The changes we talked about today are real. Muscles can lose coordination, nerve signals can become less reliable. Your body may gradually become more prone to dehydration, and common medications may quietly slow the digestive system. But understanding those changes is exactly what allows you to work with your body instead of against it. Today, you learned why straining often makes the problem worse, why what looks like diarrhea may actually be a blockage, the warning signs that should never be ignored, and the everyday habits that may help reduce the chances of this happening again. That knowledge matters because the goal was never simply to get through today's bowel movement. The goal is to help you stay comfortable, confident, independent, and in control of your health for years to come. Now I'd like to hear from you. Have you ever experienced this problem? Or did anything you learned today surprise you? Let us know in the comments below. And if you found this video helpful, don't forget to subscribe to the Aging Code for more evidence-based insights into healthy aging. Thank you for watching, and I'll see you in the next video. If you found this video helpful, please take a moment to like it and share it with someone you care about, because this is exactly the kind of information most people never hear until the problem has already become much more difficult to manage. And if you want to better understand the hidden changes that happen inside your body after 60, subscribe to the Aging Code. Every week, we explore the science behind healthy aging so you can better understand what your body is trying to tell you. And in our next video, we're going to talk about something that affects millions of adults over 60, yet most people never realize. It could be a signal of something happening deeper inside the body. If you wake up with a dry, sticky mouth before you've even had your first sip of water, you won't want to miss it. I'll see you there.